HRSA to share information about two exciting rural health funding opportunities that are open for application now. The DRA and HRSA are working together to connect Delta communities to funding opportunities that can help improve health outcomes in the region. I believe today's webinar marks the first in a series of in-person and online technical assistance sessions that will be co-hosted with HRSA in order to increase the number of quality of applications for federal HRSA funding from our region, which is obviously an important priority for us. The need for preventative interventions in quality health care in the Delta is tremendous. As many of you all know, we have obesity rates 7.4% points above the national average. And we also have a higher percentage of adults diagnosed with diabetes and a long list of other chronic diseases that are certainly more prevalent in the Delta region than in any other areas of the country. Poor health outcomes impact not only the quality of life for Delta families, but the productivity of our workforce. We have an impressive roster of participants on this call, I noticed, representing higher education community, community-based organizations, healthcare professionals, and even our local development districts from across our 8-state region. All of you all on this call, I truly believe, have the know-how and the talent needed to improve health outcomes. Working together, we can build the health networks needed to efficiently uplift our communities. We can train the health professional workforce needed to combat health professional shortages, a reality that all too many of our rural communities face every day. The DRA is committed to bringing new funding opportunities to your attention and providing the technical assistance needed to increase our competitiveness for federal funding. I want to thank you for going after this funding, and like the two we will discuss today, and more importantly, thank you for your commitment to helping improve access to quality, affordable health care and the lives of the almost 10 million people that make up the Delta regional footprint. I believe that we have Marsha Colburn from HRSA's Federal Office of Rural Health Policy with us to present on the Rural Network Allied Health Training Program, and I would invite Marsha to take over the call now. Thank you for listening to me, and thank you for your hard work.
Hi, Marsha. Real fast before you get started, I wanted to make sure that all attendees were aware that if you have any questions for our panelists, if you'll please enter those questions into the box at the bottom of your control panel, and we will be logging those and have a full Q&A session at the end of each of the three presentations. So please feel free to enter those questions in as we go along, and we'll make sure to address them at the end of the presentation. Marsha?
Good afternoon, everyone. My name is Marsha Colburn, and I just want to say that the Health Resources and Services Administration and the Federal Office of Rural Health Policy is pleased to continue supporting the Delta region. We're excited about this webinar today, just as we are excited about the pilot programs that we're going to discuss today, as well as excited about having one of our grantees to participate and talk to you about some of her experiences. And again, my name is Marsha Colburn. I will be the program coordinator for the Allied Health Program, and after I speak, you will hear from Sada Afai, who is the program coordinator for another one of our pilot programs that she'll further discuss, and Donna Newchurch, who is one of your Delta regional neighbors, who is a grantee there in the Delta region. Next slide, please. And in an effort to continue this supportive relationship, we will be sharing, again, some of the funding opportunities today, and these are pilot initiatives specific to the Federal Office of Rural Health Policy. Let me also share that this is a special presentation that was made just for you all, so you know that you are special and dear to our hearts and our efforts. So today what we're going to do is have an overview. We'll start with an overview of what we're going to talk about today. We'll talk a little bit about the Federal Office of Rural Health Policy. We'll talk about the opening or the open funding opportunity for both the Allied Health Training Program as well as the federal opportunity announcement for the Care Coordination Program. And Sada will talk a little bit about how to actually apply for not only the Care Coordination application, but also how to apply in general for Allied Health and other ORHP funding opportunities that might be coming down the pike. She'll talk a little bit about tips for writing grants as well. And then our grantee will come in and she will talk about her experiences, and she'll share some tips that will be helpful to you as well. After Donna Newchurch has actually completed her presentation, then we'll open it up for questions and answers. Next slide, please. Next slide. So the Federal Office of Rural Health Policy was created to support the efforts of and the needs of rural America. We are the voice of rural, if you will, and we are representative of both the Department of Health and Human Services as well as Health Resources and Services Administration, hence the name Federal Office of Rural Health Policy. Some of the roles of the office include policy and research, review of HHS regulations, and the administration of grant programs, as well as providing technical assistance. In the policy portion of our or policy division of our office, they look at not only the policies that impact the Delta region, of course, but rural America that sometimes are proposed but don't necessarily get a real good feel for how a policy can impact rural America. So it is our voice that speaks for you to talk about how maybe there's some tweaks or some changes that might be able to help support and be cognizant of the issues that are true to rural America. And again, of course, we have the administration of grant programs, which most of the grant programs are in the community-based division, and we also provide technical assistance. Next slide, please. So, President Obama established the White House Rural Council to address challenges specifically in rural America, to build on the administration's rural economic strategy and to improve the implementation of that strategy. And we were pleased to find that DRA is an active member of the White House Rural Council and proactively develops partnerships with other federal families to help attract resources, technical assistance, and programs to Delta communities. In fact, Chris Massengel, your co-chairman of the Delta Regional Authority, actually sits on the council on behalf of DRA. Next slide, please. So the White House Rural Council has some elements, 4 elements that they actually look at in order to improve the overall health in rural America. So the key elements are building a programmatic evidence base, health workforce and recruitment, telehealth, and HIT coordination, and cross-governmental collaboration. Now, as far as the building of evidence-based programs, that's important because what we like to be able to see is if programs aren't able to use evidence-based materials indicating that these practices have been used over and over and over again, and they have been proven to be effective and efficient, then promising practices, practices that maybe have not been tested over and over again, but we know that they work in the region. This particular program, the Allied Health Training Program, is not necessarily focused on evidence-based, but what we would like to see is to use these some of the outcomes of the individual grants with the individual projects to be able to use them as promising practices for the future. The telehealth HIT coordination is an emphasis on working in telehealth so that regions that have do not have good access to, say for instance, to physicians and or specialists, that they would be able to make a connection with telehealth initiatives and telehealth coordination. We do have the Office of the Advancement of Telehealth within the Federal Office of Rural Health Policy as well. And of course, cross-governmental collaboration is really important in all of the initiatives that we have, because it's really good for the different agencies to work together and to be able to come away with more of an impact in terms of the overall efforts that we have in terms of improving health. Now, this particular initiative, the Allied Health Training Initiative, will really focus on health workforce and recruitment. Next slide, please. So, the Office of Rural Health Policy has had some experience with working with health workforce programs. And the Allied Health Training Program actually builds on the initiatives and the experiences that we've had. A program ended in 2013, the Rural Health Workforce Development Program. It had some great outcomes. And what happened was that we found that the actual trainees, that 75% of them actually were able to complete the program, and several of them actually went on to practice in rural areas. And that's what we would like to see in terms of recruitment and retention. Currently, we have the Rural Health IT Workforce Program, and that's 15 grants in 15 different states. And pretty much that supports activities that are related to recruitment, education, training, and the retention of IT specialists very specifically. Next slide, please. So this Allied Health Training Program, the purpose of this program is to support the administration's rural health care initiative by focusing on recruitment and retention activities, as I said earlier. The Rural Network Allied Health Training Program, the legislative purpose, will be achieved through the recruitment, the clinical training, and the retention of allied health professionals. Next slide, please. So the legislative authority actually is the purpose of the authority is for the development of grants, and is to provide for the planning and implementation of integrated rural healthcare networks. And we would like for them to be able to achieve efficiencies, expand access to coordinate and improve the quality of essential healthcare services, and strengthen rural healthcare, the healthcare system as a whole. Next slide, please. So with this particular initiative, the applications are due March 31st, 2015. So that's not too long from now. March is next week, and I just can't wrap my head around the fact that it's almost spring, but I guess maybe with all the snow that we had, we want the spring to come quickly. But the March 31st is the actual due date, and that's at 11:59 Eastern Standard Time. So you want to make sure that you have your applications in on time and that they're not rejected because you are on your the difference in Eastern Time, Central Time, or whatever time it is that you happen to be on. So we have 10 awards that are going to be granted, and the funding amount for each awardee each year will be up to $200,000 per year, and it's a 3-year project. So when we think about the actual eligibility requirements, it's important to know that the lead applicant organization must be a public or a private nonprofit entity that's located in a rural area. The network must be a formal network and composed of at least 3 separate existing healthcare providers. Next slide, please. So that is to say that the actual applicant organization must have an address that is in a rural area. the applicant organization cannot be in an area other than rural and happens to provide services in a rural area. What we suggest that if there is an organization that is interested in applying it, but they don't have an address in a rural area, then they should indeed partner with an organization that is in a rural area. It's important also for there to be 3 organizations that have separate EINs, and those 3 organizations, it could be much more than 3 organizations, and we're focusing on the lead applicant organization, but it needs to be at least 3 organizations. And that lead organization must be a network organization, and it cannot be, in this instance, cannot be a community college. The community college will partner with the network organization. Next slide, please. So I'm not going to go over all of this because I know we have a lot of speakers behind to come up, but the program goals are there, and they're really specific in terms of what it is that we would like to be able to do. We certainly want to do the recruitment and retention, as I've said before, but we also want the students or the graduates to be able to experience an opportunity in an area where that's of course rural, and that they will be able to build on their experiences vocationally, and that their training will be appreciated and accepted into a rural area, and that the approach that the actual organization is using can be replicable, which again leads to the promising practice or the evidence-based practice. Next slide, please. So we're very specific in terms of what it is that we're looking at. We were able to take a look at some of the needs in rural areas, and there was an outstanding outcome that clinicians, technologists, or technicians, and other allied health disciplines were necessary. But not only that, we had the listing of those that are particularly necessary or needed, I should say, in rural areas. And so the ones that are listed here on the slide are also listed, of course, in the funding opportunity announcement, and it's these and these alone that we will be accepting for this particular funding announcement. Next slide, please. Next, okay. And so this is a look at some of the weight in terms of the overall application. On the left-hand side are the different categories or the different sections of the actual funding opportunity announcement that are necessary. And on the right-hand side kind of gives you a feel for how they are weighted and what the final score would actually be. Next slide, please. So myself, I am the program coordinator, and Nancy Gaines is the budgetary or the fiscal person that will be assisting in this particular initiative. Next slide. And now I'd like to introduce Sada Afai, who is a program coordinator for the Rural Healthcare Coordination Network Partnership Program. Sadi?
Thank you, Marcia.
Sada.
And thank you to DRA for hosting this webinar. Good afternoon. I'm absolutely delighted to be on today's call. And as Marcia mentioned, this is special for the Delta region. My name is Sada Afai, and I am a program coordinator for the Funding Opportunity Announcement HRSA 15-123, or the Rural Healthcare Coordination Network Partnership Program, or what we're calling for short, the CARE Coordination Program. I'm a public health analyst with the Health Resources and Services Administration, or HRSA, and the Federal Office of Rural Health Policy. So let me tell you a little bit more about the CARE Coordination Program. Next slide, please. As Marcia mentioned earlier in her presentation, the White House Rural Council is the first body of its kind to engage at the cabinet level agencies in addressing the challenges facing rural America. And under these auspices of the Council, back in 2012, the Federal Office of Rural Health Policy partnered with grant makers in health and the National Rural Health Association to encourage new public-private partnerships in rural health. And if you're interested in learning more about the collaborations that I'm talking about, you can go to page 3 of the funding opportunity announcement or the FOA to see that site, and it's also listed here on the slide today. Next slide. So a summary of the funding opportunity announcement: the estimated number of awards for the Care Coordination Program will be up to 8 grants. The estimated award is up to $200,000 per year. The project period will be from September 1st, 2015 to August 31st, 2018 for a total of 3 years. And the deadline to apply for this funding opportunity announcement is April 6th, 2015 at 11:59 p.m. Eastern Time. And applicants will need to submit their application electronically to grants.gov. Next slide, please. The purpose of the Care Coordination Program is to support the development of formal, mature rural health networks that focus on care coordination activities. And the goals are to promote the delivery of coordinated care in the primary care setting, reduce the impact of chronic diseases prevalent in rural communities. Specifically, we're targeting type 2 diabetes, congestive heart failure, and chronic obstructive pulmonary disease. And we're hoping to build upon these evidence-based, evidence-informed, promising practices that you all have in your communities in the delivery of this coordinated care. And lastly, we want to improve population health, demonstrating health outcomes and sustainability of these programs. Next slide. So what makes the Care Coordination Program unique? There are a few things that make it unique. The Care Coordination Program will focus on promoting the delivery of coordinated care, and this will be promoted through network partnerships and community buy-in and collaboration. We are looking to improve population health, and that goes hand in hand with the outcome-oriented and attention to chronic illnesses. Funded applicants will make an impact at the community level by improving population health and demonstrating improvement in health outcomes. Through the funded programs, the aim is to decrease chronic illnesses through the coordinated activities and care. Care coordination pays close attention to patients' needs and preferences, which translates into high quality, high value health care. Next slide, please. So I kind of touched on this already, but what is care coordination? Our definition is on page 32 of the funding opportunity announcement. It states that care coordination involves deliberately organizing patient care activities and sharing information among all of the participants concerned with the patient's care to achieve safer and more effective care. Page 1 of the FOA provides a deeper dive on this definition of care coordination. Health care coordination for people living with chronic conditions is vital to providing high quality care, especially in rural areas, as we know. The main goal of care coordination is to meet patients' needs and preferences in the delivery of this high-quality health, high-value health care. So what does this mean? This means that the patient's needs and preferences are known ahead of time and communicated at the right time to the right people. So this information is used to provide safe, appropriate, effective care to the patient. And care coordination is identified by the Institute of Medicine as a key strategy that has the potential to improve the effectiveness, safety, and efficiency of the American healthcare system. Well-designed, targeted care coordination that is delivered to the right people can improve outcomes for everyone. We're talking about patients, providers, and payers. Next slide, please. So I won't go into too much detail about measures today, but I do want to address it, as you will have to note that in your application. So it will be on pages 13 and 14 of the funding opportunity announcement. But everyone who applies will be required to report on these outcome measures that you see here on the slide related to care coordination core measures. And I listed the 3 that are required. Okay, next slide, please. And so, as you can see here, this is also a grid to show you all of the the measures that we're asking for the care coordination program. So the care coordination program will focus on these 3 chronic illnesses, as we mentioned before: type 2 diabetes, congestive heart failure, and chronic obstructive pulmonary disease. And applicants are expected to address 1 or more of the following chronic diseases. And we already know that rural Americans are unhealthier with higher rates of chronic illnesses, such as diabetes, CHF, and COPD, and have higher rates of high-risk behaviors such as smoking, physical inactivity, and poor nutrition. We're really trying to target this in this program. These high-risk behaviors cause many of the illnesses, suffering, and deaths due to chronic illnesses and conditions. The increasing prevalence of chronic diseases at high cost of the healthcare system in the U.S. bring treatment of the whole person to the forefront, especially as there are often psychosocial issues related to chronic diseases, for instance, diabetes and depression. So what you see here on the slide is at a minimum, if you decide to do type 2 diabetes, we have 4 listed under type 2 diabetes. For instance, you would have to do these measures. These are called core measures. And then applicants are allowed to report on additional measures of their choosing beyond those measures. So for instance, type 2 diabetes, you would have to do these 4 core measures that you see listed here, also listed in the funding opportunity announcement. And then you can do optional measures within diabetes as well if you want to do additional measures beyond these 4. Next slide, please. Okay, you can skip this slide. This is a duplicate. Thank you. Okay, so I will talk about eligibility. So some of the information is similar to March's program, but please keep in mind some of the differences that you might see. So the lead applicant must be rural, and this can be verified on a website that we have called the Data Warehouse. It's listed in the funding opportunity announcement, and it is what the Federal Office of Rural Health Policy uses to determine what is considered rural. So even if you might think that your area is considered rural, please make sure that you enter your exact address into the Data Warehouse to confirm. You also have to be a nonprofit or public entity, and you'll provide documentation to show that, and represent a mature network of 3 or more separate existing healthcare providers. And healthcare provider, a definition can be found at the bottom of page 33 in case you want more information. And the lead applicant, if awarded, will be the grantee of record, and they must have a financial and management system in place. Next slide. Since this FOA has been open, I've received some frequently asked questions, and I just want to address a few of them today. So one of them is, my organization is located in a metropolitan area, and we serve rural communities. Are we eligible to apply as the lead? As Marcia said, and for my program as well, no. As stated on page 4 of HRSA 15-123, an application that proposes a network serving rural communities where the applicant organization is not in a designated rural area will not be considered for funding under this announcement. So again, you can work with another community organization that meets the eligibility requirements and be a part of the network project involved. Next slide, please. So what are we talking about when we're talking about network requirements? Again, the network has to be composed of at least 3 healthcare providers that are separate existing organizations, and that requires them to have their own EIN number. The network organization relationship is formal, and what we mean by that is that they can demonstrate a history of collaboration. Only one member can serve as the lead applicant or the applicant on record, and they must meet all of the eligibility requirements. And the network has a governing body that includes representation from all network member organizations. Other members can be nonprofit, for-profit, rural, or rural, non-rural or urban. And the network has a permanent network director. Next slide. Okay, am I still eligible to apply if I'm a current or former Federal Office of Rural Health Policy grantee? And yes. So if you are a current or former grantee, you are still eligible to apply as long as the proposed project is a new proposal or an expansion enhancement of the previous grant. So for instance, an expanded service area, you're trying to serve a new population, or providing a new service. And this is not an opportunity to seek funding to maintain your current operations of the previous grant. Next slide. Applicants must notify their state office of rural health of their intent to apply. You can see page 7 of HRSA 15-123 for more information about that. Just want to let you know. Please make sure you get that in early so you can get a response, but even if you don't, there's some more information on page 7 about what you can do if you don't receive a response. Next slide, please. Okay, you will need to submit the following items with your application, and I would just suggest that you don't change the section headers that are listed in the application, and you can refer back to the funding opportunity announcement to see what actually needs to be addressed in each of these area and subsections. I'll just take a moment for you to just look at this slide because this table is not in the FOA, but because we're not allowed to include tables. However, I think I just thought it would be easier for today's presentation for you to be able to see what is it all that you need. So just take a moment to look at that 1 through 9. Okay, great. Next slide, please. Okay, so understanding the application review process. When you have successfully submitted your application, it will be reviewed by external reviewers. So the Division of Independent Review here in HRSA will convene panels of external reviewers who will ensure that these reviewers assess each application based on the review criteria in a fair and ethical manner. So once the review is completed, the Division of Independent Review will provide a summary of strengths and weaknesses, comments from the panel's deliberation and scoring of each of the applications. Next slide, please. So this slide here, so you know that you're going to be reviewed and scored based on the review criteria. It's really important that you follow that and you can see how many points are assigned to each section. So as you can see, the introduction needs section, which aligns with criterion 1, the need, which you saw a few slides earlier, is worth 15 points, for instance. So make sure that you kind of either create a table for this like yourself or download the slides and kind of get a sense of how are we scoring you and really where is the meat of that going to be. So the next slide, please. So this is my contact information. If you have any questions, I'm getting back to people within 24 to 48 hours. I'd be happy to give you some more information. I'm under the program.fi. Feel free to write down my email. Again, Ann Maples will be the grants management specialist. So if you do have any questions related to budget or fiscal concerns, you can reach out to Ann and or myself, and I'll make sure that I'll let you know, okay, you can reach out to Ann instead of myself, and we'll get you an answer. And again, if you do have any issues with grants.gov, please use the support help desk. There's an email listed here, support@grants.gov, and the phone number is listed here as well. Next slide. So I'm just going to share a little bit about how to apply for these funding opportunity announcements, and they do apply to both Marcia and my grant. Next slide, please. So there are 2 key steps for an applicant when they should remember when applying for this grant. So step 1, register in the 3 different systems. Or if you're already registered, please make sure that your information is current because some information will need to be renewed annually. And step 2, you want to look for some open funding opportunity announcements. So that's kind of the basics of that. Next slide. There are 3 different systems that an applicant must register for when applying for any federal grant. The first system is the Data Universal Number System, or the DUN system, which is required to identify organizations and to track how federal grant money is allocated. The second system is the System for Award Management, or SAM, which designates an e-business point of contact. And you must register with SAM. It's required for organizations to use grants.gov. So you have to have a SAM's number in order to go into grants.gov. And finally, an applicant must register in grants.gov, grants.gov. This is the system where you will submit your grant application. If you have any questions about these 3 systems, you can see the websites listed to the right on this table. Please visit those websites for more information and for troubleshooting. Next slide. How long does this registration process take? Well, it can take up to 4 weeks. So it's really critical that you, as soon as you get off this call, you get started with the process sooner rather than later. And we have some incidents where applicants were unable to submit their application because the registration was still pending. So I can't emphasize this enough. So next slide, please. Next, you would go to grants.gov to look for federal funding opportunities, or if you already know the funding opportunity that you specifically want to apply for, you can simply enter the information into the search window. I'm just going to show you some screenshots just so you can get a sense of what do these look like if you've never been in it, and if you have, maybe it's changed a little bit, but that's what the next slides will be. Next slide, please. Also, I just wanted to let you know that this is just an example of a screenshot. It's from another grant program, but it looks identical to the process that you'll need to follow to download the application package. So for this specific announcement, the Care Coordination of the Allied Health, you can download the application under the Applications tab. So you can see the arrow pointing to that. So the fourth tab over, click on that, and then you'll be able to do that under the Applications tab. Next slide, please. So then you just download the application instructions and the application package. There's 2 items listed there after you do that. Next slide. Okay, so here you'll find some screenshots of what you should download from grants.gov. And I really just want to emphasize the standard form 424. Please read through that guide. It provides a lot of detailed information such as spacing and formatting, numbers of pages, submission instructions, waivers, and much more. So I won't be able to answer any questions related to downloading the application as far as what's in the 424, so please make sure that you call grants.gov if you're having any issues with that. And the contact information will be, again, provided in the next few slides. Okay, next slide, please. Okay, so this is actually what I was talking about. Sorry, this is the SF424 on the right. It just gives you some more information. All right, next slide. Make sure your application is complete when you submit in grants.gov, and watch for your email for a submission confirmation. An applicant must receive at least 2 emails by the application deadline, an email that confirms receipt and an email that validates the application. Please submit your application early to avoid any issues with your submission. And you can also track the status of your application once it's submitted. You can refer to the HRSA SF424 application guide for more information about that. And we will notify successful applicants at some point in 2015. Next slide. So as I close out the portion of my presentation, I want to share some helpful tips as you write your grant proposal. Next slide. As you start preparing for your applications, here are some questions to ask yourself. Have I read the entire funding opportunity announcement and the HRSA SF424 application guide? I would start early. The devil's in the details, and it takes some time for you to gather data and information that's needed for your application. So is my organization eligible to apply? If you're not eligible as lead applicant, can you, be a network or consortium member with someone else who has the technical expertise? And you want to make sure that they meet the eligibility requirements. And again, you want to ask yourself, if you do want to apply as a lead applicant, does my organization have the technical expertise, the personnel, and the financial capacity to successfully manage this grant if awarded? Are all stakeholders in my consortium or network supportive? You might want to build a team to write this grant, and this is a way to get a sense of ownership and a buy-in of this project. And lastly, is my organization prepared to do what it takes? When you're knowledgeable with what you're proposing, it shows in the quality of your application. Next slide, please. So as stated earlier, all eligible applicants and applications will be reviewed by a panel of external reviewers. These reviewers will know nothing about your community and the needs that you're trying to address. So make sure you paint the right picture. After you have written your project narrative, you might want to give it to someone who's not involved with your project and have him or her read the proposal. If he or she finds the project narrative difficult to follow, then the chances are that external reviewer will as well. Next slide. So I'm really excited. That's the end of my presentation. I'm really excited to bring on our grantee speaker. We are really fortunate to have Donna Newchurch expertise and perspective on the call today. Donna joined the Louisiana Rural Ambulance Association Alliance, as Chief Executive Officer in May 2006. She is honored and privileged to continue to serve in that role today. Prior to joining LRAA, Newchurch served in the Louisiana Rural Health Association as the Executive Director since 1998. She serves on several committee boards and advisory panels, including the Inpatient Advisory Group for the CMS contracted Quality Improvement Organization in Louisiana, the Louisiana Traffic Records Coordinating Committee, and the Louisiana Rural Hospital Performance Improvement Project, the statewide Executive and Operable Communications Committee, the Louisiana HRSA Advisory Committee, and the Louisiana CDC Advisory Committee, and the school board as well. So as you can see, she has a wealth of knowledge, and she's served and helped out the communities in various ways. So prior to her association with LRHA, Newchurch provided grant writing services on a contract basis to several rural communities based and in nonprofit organizations. So she successfully has secured federal, state, foundation funding for projects from abstinence education to AIDS, HIV education, from internet connectivity for rural hospitals to a wellness center for rural senior citizens, from dental care for rural populations to book stipends for nursing students. And now I would like to turn it over to Donna. Thanks, Donna.
Hi, Donna, are you there?
Okay, everybody.
Donna, are you there?
Yeah, I'm here. I'm sorry. I think that my introduction was actually longer than my presentation will be, but I appreciate that. Just to let everybody know, I did write that bio about myself, so just for complete transparency. I would like to add kind of the real bio, I guess. I live in Napoleonville, Louisiana, which is about 60 miles from New Orleans and about 45 miles from Baton Rouge. I'm 8 miles from the Mississippi River. We have about 11,000 people in Assumption Parish. The town I live in has about 1,200 people. The population density is about 1 person for every 30 miles in our parish. We have a critical access hospital. We have a rural health clinic. We have an FQHC. We have 2 private physician offices. We have 1 high school. We have a fabulous dairy inn where you can get hamburgers and fried okra that taste better than just about anything you've ever had. So I hope that I'm talking to folks that are a lot like me. I suspect that I am. And I hope that at the end of this presentation, you'll be encouraged and enticed to submit an application to one of the 2 opportunities that were discussed today. So, next slide, please. So for us in our office, we really don't look at applying for a grant as a one-time event, right? It's incorporated into what we do as an organization. So I hope that everybody conducts an annual strategic planning retreat, and we do here for the Ambulance Alliance. But in addition to the general and mundane SWOT analysis, your strengths, weaknesses, opportunities, we also do an organizational inventory of what we have. And so we inventory the organizational products that we have. So for the Ambulance Alliance, we have membership meetings, we have a newsletter, we have a website, we have data. By virtue of the members, we have surge ambulances that can respond to an emergency or a catastrophic event. And we catalog all of those items. We also talk about our organizational partners. And I think those are probably a lot like your organizational partners. The Hospital Association, the Primary Care Association, our State Office of Rural Health, our Health Information Exchange, that kind of stuff. So we inventory those folks. And then we inventory the skills of our internal staff. We have somebody who's a crackerjack with budgets. And not only can she come up with an appropriate budget, she can also capture that in the budget narrative. So that's important as well. We have somebody who can do graphics and things like that. So in the grant application, when it says include a map detailing the location of all of your network members, we have somebody that can do that. If we didn't, we have a different list, which we call our shopping list. So if we didn't have Becky on staff, if we didn't have Brooke on staff to do those kind of things, we would kind of create a needs list separate from what we already have. And of course, we all talk about this and communicate internally. And then we go shopping for what we have on that list every chance we get. Next slide. So we're shopping, right? And you heard that big laundry list of boards that I sit on. I suspect a lot of you sit on a lot of boards. I find that's true in rural communities. So have your shopping list with you and your pantry items with you at different board meetings, and when you go to your membership meeting, and when you go to community forums and press conferences and presentations. So when we have a membership meeting and we get a lot of questions about ICD-10 implementation or HIPAA compliance, I know what I have in my pantry if I have somebody that can meet that need. And if I don't, I add that to my shopping list, and the next time that I'm out in another community forum, or if I'm at a press conference, or if I'm at a presentation, and I hear somebody speaking to the ICD-10 issues we have, or the HIPAA compliance issues that we have, then I add them to my pantry. It's easy enough to do. It's also important to know what things on your shopping list might cost. So I've got a great story. For the Traffic Records Coordinating Committee, they are into data, TRCC, and they collect data. They need mortality data on motor vehicle accidents. And so about 12 months ago at the TRCC Executive Committee, as we went around the room and talked about our updates, the folks that work for state police spoke about a specific challenge that they had collecting mortality data related to motor vehicle accidents. So they had an incident number from state police, but they had no way to match that incident number with the outcome of the person involved in the accident. Well, in EMS, we have an electronic patient care report. And so by adding a data element for the state police incident number to our patient care report, we created a link between the data that they needed and the data that we had. Now, we couldn't give them all the data they needed simply because we didn't have enough laptops to put in every unit, in every EMS unit in the state. And so when the executive committee said, Donna, what do you need to provide the information that we want? My response was, I need laptops. And their response was, how much does it cost? So had I not been prepared to let them know what that cost was, I might have missed out on that opportunity. So again, that speaks to your shopping list and your pantry and why you need to do that inventory at least annually. Next slide. So now that you have your shopping list and your pantry inventory and that kind of stuff, I'm going to speak to the things that they just talked about, the 5 steps to preparing to submit your grant application at grants.gov. There is a 5-step process. It can take from 5 business days to 1 month. When I first saw that, I thought certainly that should not take 1 month. But I can tell you, next slide. That first step to get your DUNS number, so you go through that process and then they send you an email to confirm that you actually want to get a DUNS number. Same thing with SAM. You can't do SAM until you do your DUNS number. So you register with DUNS, you complete that step, you go into SAM, they send you a validation email, you validate that, Then you go to step 3, step 4, step 5. Unless you're sitting at your email, it might take you a day or two to validate those steps. So if you take 5 steps times 2 days, that's 10 full days, right? And then you've got weekends in there. So again, that's where that 30 days comes from. They're not exaggerating when they say it could take more than 30 days. Next slide. So again, it's just something you have to do and get it done. If you haven't started it yet, I would certainly encourage you to do it today, to start today, because it could take up to that 30 days. The deadline for Marcia's grant is the 31st. I don't recall the deadline for the other, but I think it's probably close to that. So go ahead and do that. Make sure you update it annually as well. Once you're in, you'll get a reminder email to update, but don't forget to do that. The SF-424 that they spoke to earlier, I'll put the link to that guide there on that slide, so you should be able to access that easily. Next slide. Right, so while we're going over kind of the tedious things involved in having to complete to prepare your application, Marcia asked me to speak to some of the things that we do. So, you know, it's not so obvious, so I'll just go ahead and say it. Just sign up for grants.gov. Get that done when you're completing your registration. And then I would recommend setting up a reminder on your calendar. It's not hard to do, but say you pick the second Tuesday of every month at 10 o'clock, and you set that as an appointment on your calendar. And on that second Tuesday at 10 o'clock, you go to grants.gov, you go to NRHA, you call your state office of rural health, and you have a conversation with them about grant opportunities. Next slide. So on the second Tuesday of last month, you found a grant that's awesome, that fits right into your strategic plan and have everything on your shopping list. So the first thing you're going to do, obviously, is read over the program description. As I stated earlier, you're going to confirm that your organization meets the eligibility requirements. And then you're going to look at the application deadline. And you're going to subtract 3 days from that deadline. So the deadline for Marcia's Allied Health grant is not March 31st. The actual deadline is March 28th. You register to receive any program announcements or application changes via email. And then you start a new folder on your desktop, or on your OneDrive, or on your Jump Drive, or on your cloud, or whatever y'all use, and put everything related to the grant application in that folder. Everything. So if you have a copy of your 501c3 designation letter in your administrative or historical folder, make a copy of it and put it in your new grant application folder. Because when you go ahead and do all the attachments, when you're submitting your grant, you just want to pull from that one folder. You want to make sure that you have the most current document for everything. You download the full program announcement, and you put that in your new folder, and then you print out the full program announcement. If you're required, go ahead and submit the letter of intent, and then if there are any grant-specific conference calls, be sure to participate in those. Next slide. So you don't want to find yourself in a 911 situation, right? Even though I'm an EMS, I do everything I can to avoid having to call on my members. So you're going to develop a timeline for completing your application. So using your application deadline, which is actually 3 days prior to the actual submission deadline, you're going to back into the dates and identify a responsible person for every required section of the grant. So the budget, and this is just an example, right? So the budget, Donna's going to complete that, and she's going to have that done by February 28th. The organizational chart, which has to be included as an attachment, Becky's going to do that, and she's going to have it done by March 1st. Attachment 4, the key staffing positions and job descriptions, I'm going to do that as well, and I'm going to have that done by March 1st. So in your program guidance that you printed out, you're going to write the dates and the person responsible for completing that in the margins of the program guidance. Next slide. So love a computer, awesome, can't live without it. But for this process in our office, we actually use a lot of paper. So we take our program guidance and we develop a mock paper application. So for every component of the grant that has to be attached or submitted, we develop a one-page sheet on that. And we also write the dates and the responsible person in large print, 1 page per section. So if it's a narrative, we write narrative to be complete by Donna on March 12th. And when that narrative is complete, we print it out, pull out our placeholder page, and put the actual narrative in the mock application. And then we put all of those pages in the order that they're listed in the guidance. So again, as we complete each section, we print that out and pull out that blank placeholder page and put what we've actually written and what we plan to submit with the grant in the document. Next slide. And I think they said this earlier too, right? Make sure that someone who has not prepared the application reviews the application. But it's really not rocket science. Everything you need to submit a competitive application is in the guidance. It's just Q&A. Answer the questions as they appear. Address all of the review criteria that's in the guidance, and don't forget to request the funding preference if you qualify. I know they said that you have to be a rural applicant in order to apply, but you also have to specifically ask for the funding preference if your organization qualifies, so don't forget to do that. And then, have an outsider read the application. So now you're done. You've replaced all of your mock pages with the actual pages. Give them that complete document, give them a copy of the guidance, and have them sit down and read it. Make changes that they recommend, you're ready to submit, and you're 3 days early. Next slide. As I'm from South Louisiana, of course I've got a food-related story to close my presentation. And it's one of my favorite stories. If you've heard me speak at NRHA or at a federal office conference, you may have heard it before, but here it goes. So these two guys go to work on a construction site, and they start on the same day, and they're doing pretty much the same thing. It's Joe and Alan. So Joe and Alan show up on Monday. The supervisor comes up and says, all right, fellas, y'all head on over there. I'll give y'all a break around lunchtime and then check on you then. So Joe and Alan go to work. Sure enough, about 11:30, the supervisor comes up and says, all right, fellas, time for a break. Head over to the canopy, eat your lunch. So Joe and Alan walk over, sit down, and open their lunch pails. Joe picks up a sandwich and starts to eat. Alan opens his and says, oh, peanut butter and jelly sandwich. Really can't stand peanut butter and jelly. But he eats it. Joe and Alan spend a few minutes together. The supervisor comes back, says, fellas, time to head back to work. Same thing on Tuesday. Joe and Alan show up for work. Supervisor assigns them, goes to them a few minutes before 11 and says, all right, fellas, time for lunch. Head on over to the canopy. Sure enough, Joe and Alan walk over, start eating lunch. Joe opens his lunchbox, meatloaf sandwich, starts eating, happy as can be. Alan opens his lunch pail and he says, oh, peanut butter and jelly, I just really can't stand peanut butter and jelly. But he eats it anyway. Third day, same thing. Joe and Alan are sitting down eating lunch on Wednesday. Joe opens his lunch pail, starts eating. Alan opens his lunch pail and says, peanut butter and jelly. And Joe says, look, Alan, just ask your wife to make a different kind of sandwich. And Alan said, what are you talking about? I make my own sandwich. I hope you're inspired to take the items from your pantry and your shopping list to make a sandwich for the people that you serve. And that's it.
Okay, thank you, Donna and Sarah and Marsha. Ooh, we have some feedback. Let's try that again. Thanks everyone for your presentations. I'd like to move to question and answer session now. We have a few questions that came in already. I also encourage any of those participants who are on the call who have questions, please feel free to type those questions in to the question box and we will address them. I am going to give the floor to our presenters so that they can help answer the questions. The first question we have is directed to Marcia, and that's with the Rural Allied Health Grant. You mentioned that community colleges could not apply. With that, though, could universities apply for this grant? Are universities eligible, whereas community colleges are not? Marcia?
No,
Marcia, are you there?
can you hear me?
Yes, we can hear you.
Okay, great. It's not that community colleges cannot apply. It's more so that the legislation is really for network organizations. So that is to say that the network organization must be the applicant organization. And if it is a community college, a vocational college, a university that has certificates with allied health, they would partner with the network organization. So I hopefully that's a little bit clearer.
Great, thank you, Marcia. I believe that answers the question. A few questions that came through were regarding the presentation slides, and we will be making the HRSA presentation slides available. Donna, if you could confirm that you're okay with us releasing your slides as well, we will make sure to send those slides through a link in a follow-up email. Donna, is that okay with you as well?
Yeah, that's fine.
Great. So yes, everyone, we will be sending out a follow-up email with helpful links and the slide presentation so that you can reference it in the future. Do we have any other questions? I believe we might have a few more coming in. If you have any questions, go ahead and type them into the question box at the bottom of the control panel and we will address them. Well, Sarah, Donna, and Marcia, I guess you did a great job presenting. There don't seem to be any questions. We can hold for a few more seconds to see if anyone else has a question to submit. And with that, we will move to conclude the webinar. On behalf of the Delta Regional Authority, I'd like to thank everyone for joining us, and many thanks to HRSA and the Federal Office of Rural Health Policy for joining us for this webinar today and helping connect our stakeholders in the Delta region to opportunities through HRSA and federal funding for Delta communities. I'd like to hand it over to HRSA for any final comments. Sarah, Darcy, or Marcia?
Yeah, this is Darcy Eswine from HRSA, and I just wanted to say thank you, everybody that took the time to join this afternoon. I hope wherever you are, you're staying warm and enjoying the snow. You know, this is kind of a precursor to a larger initiative that we're going to be working on with the DRA to provide more targeted technical assistance to communities in the Delta region. So we look forward to building on that and working with you guys more throughout the year.